Hey there, future nurses. Welcome to Guided by Night. I'm Dr. Knight, your DNP nurse educator and mentor. Today, guys, we're going to be diving into one of the most important skills that I feel that nurses must master today. And that is focus assessments. And I'm going to include a nursing framework, the 4R framework that's going to guide you into becoming better at performing focus assessments and actually help you to become more confident in performing focus assessments. The 4R framework includes recognizing, reviewing, responding, and reporting. Here's where you're going to begin to develop your clinical judgment, your critical thinking skills so that you are functioning like a professional nurse. So let's dive right into it. First and foremost, let's define what is focus assessment. A focus assessment is a quick, systematic evaluation of a patient's complaint or a change in your patient's condition. You are not going to be focusing on everything. You are actually going to be targeting or focusing on what is happening right now with your patient. This is how nurses work smarter, not harder. Here's how you will build confidence in your assessments using the 4R nursing framework. Say it with me, guys. Recognize, review, respond, and report. Let's break it down. Number one, recognize. This is your observation mode. You're noticing what's different and what's new about your patient. Is the patient pale, diaphoretic, short of breath, or in pain? You cannot assess what you haven't recognized. Your eyes and your intuition are your first monitor. So when you walk into the room, start scanning the room. And if your intuition tells you something is wrong, you need to act immediately. From 30 years of nursing experience, I'm telling you, your intuition is going to guide you into making better decisions for your patient. Do not dismiss your intuition. It's a guide. Number two, review. This means you are gathering content or more data. And how do you do that? Simply by asking questions like, when did this start? What makes it better or worse? And what's the patient's baseline? You're connecting today's clues, cues with yesterday's data. Good nurses always ask questions. They always ask, is this normal for this particular patient? Because remember, all of us are different. Number three, respond. Here's where you're going to start to act. Perform a target assessment based on what you recognize in your patient. If the patient says, I'm short of breath, you have to start listening to the lung sounds, checking oxygen saturation, observe your patient's posture and work of breathing, and apply oxygen if needed. Remember, response isn't just about action, it's about performing the right action at the right time. Number four is report. Now, here's where we're going to get into SBAR, because I want you guys to remember what you don't communicate can cost a patient's life. So you have to make sure that you are communicating whatever you are finding about your patient. So remember how to use SBAR. If you don't remember, I want you guys to go back and review my other videos on SBAR. But let me break it down. Situation, what's happening right now. Background, what do we know about this patient? Assessment, what did you find? And recommendation, what needs to happen next? If you notice that the patients are having new crackles when you're listening to the lungs, don't just chart it, report it to the physician. And how do we report? We always use SY. You call the physician, you identify yourself, you identify who you're calling about, the patient, the room number, the location of the patient, and you include the patient's background. You tell them your assessment findings, and most importantly, you include your recommendations. For example, you can say, I'm concerned about fluid overload because you heard crackles, and I recommend evaluating for diuretics. That's how students turn into safe, confident nurses. Let's put it all together. Recap. Recognize is the change. Review the patient's history. Respond with your focused assessment and report clear and confidently. When you follow this structure, I promise you, you will never feel lost at the bedside again. Now, here's a call to action. Remember, nursing is not about doing, it's about understanding why you do it. The 4R framework, it's going to help you move from task oriented to thinking like a professional nurse. If you like this information that you're hearing today, guys, I want you to hit the like button, subscribe, and most importantly, share it with your classmates or even share with other nurses practicing at the bedside right now, because confident nurses saves lives. And remember, I'm Dr. Knight. I want you guys to keep learning, keep growing, and most importantly, keep leading with compassion. Happy clinicals. I'll see you in the next video.